It's 9/11 now on your election day, and November is National Pet Diabetes Month. And pet owners, you should be aware cases of diabetes in cats and dogs are skyrocketing. If left untreated, this can be deadly. So joining us live to talk about this is veterinarian Dr. James Spicer with Indy Vet Emergency and Specialty Hospital. Good morning to you. This is something we really don't hear a lot about, and this is really important. So first, just tell us more about what do we need to know about diabetes in our pets?
You know, diabetes is a very interesting disease, and it actually now is affecting about 1 in every 200 cats and maybe 1 in every 500 dogs.
Wow.
And actually, diabetes is a disease where we don't have enough insulin. And insulin is a hormone that allows sugar to get inside the cell so the cell can basically metabolize it for energy. So when we have diabetes, all the cells in the body, every organ of the body is actually adversely affected because the cells are basically starving to death. Even though there's plenty of sugar in the body, it can't get it inside the cell to do its work.
Let's talk about some of the symptoms. What can pet owners look out for? What are the risk factors here, and how do we dial that down?
Well, the symptoms are very, very simple. Basically, pets are drinking a lot, they're urinating a lot, they initially are very hungry, they just can't seem to get a lot of food. Then later on in the disease, they'll actually become anorexic. One of the things that people will notice a lot is that they will become blind and their eyes will be very white because of the cataracts that develop due to diabetes. So that's one of the common symptoms that people will present their pets for, is the fact that they've gone blind because of cataracts. And of course, then they can become very weak and lethargic as well.
Let's talk about some of the treatment here, because it is good to know the treatment options are available. What are those, and how much do they help our pets?
Well, fundamentally in dogs, very interestingly in dogs, they are type 1 diabetics, so they're insulin dependent. So we're going to have to give them insulin. Cats, on the other hand, many of them are type 2, which means that they have an adequate amount of insulin. It's just not working very well usually because the cats are very obese. So treatment-wise, does require discipline. It does require dedication. In dogs, we need to give insulin a couple of times a day. They need to be fed a very specific amount and type of food, but they are very, very treatable. Cats, on the other hand, we can start them out on insulin, and if we get their weight down and treat obesity, many times the cats will resolve and they don't have to be treated with insulin anymore, and the diabetes basically resolves.
All right, Dr. James Spicer, it's something that pet owners should really watch out for. Thank you for joining us this morning on Election Day to talk about this. And for our viewers who would like a list of services at Indy Vet Emergency and Specialty Hospital, you can head to fox59.com/links.